Pranav Dar Pawb. Good afternoon, everyone, and welcome to the third and final webinar that we've got from the Health Anchors Learning Network. I am Chris Morton. I'm Deputy Director of Finance and Business Assurance at Digital Health and Care Wales, and also chair the Foundational Economy Learning and Development Group under the Finance Academy. If we recap, first of all, I think, the first couple of webinars that we've had. So in the first webinar, we explored what we mean by anchor organisations and the different levers that they can use to create positive impact in the local communities. And then in the second, if you remember, we explored how different NHS organisations are developing and implementing dedicated anchor strategies. And through that, we heard examples from the work of Cwmtaf Morgannwg University Health Board, as well as from Northumbria NHS Foundation Trust. Now, if you missed either of these, both of the webinars are actually available to watch on our dedicated learning platform, and we'll put a link to these recordings in the chat for you now, so you have those. Really looking forward to today's session, as this has been a particularly maybe challenging topic in terms of measurement. So in terms of today's session, we're looking at how health boards and other anchor organisations can measure their impact, and we'll look at some of the guidance that exists to support this. We'll firstly be hearing from Ollie Clayton, the lead coordinator for the Health Anchors Learning Network, who will provide an overview of anchor impact measurement. And then we're very grateful to welcome Arma Saeed Rafiq, who is a Senior Health Improvement Officer at Public Health Scotland. Now, Arma will talk about the work they've done to develop a unique set of guidance and support health boards in Scotland to help them measure their impact as anchors. Just in terms of quick bit of housekeeping, if you have any questions or comments as we go, please do use the chat function, and we'll also have some time for questions and answers at the end as well. But without further ado, I will hand over to Ollie, who's going to talk us through some aspects of anchor impact measurement. Over to you, Ollie. Thank you.
Thank you, Chris. Can we just start by checking that you can see my screen okay?
Yep, I can see that coming through. Thank you.
Great. So as Chris said, I'm going to talk a bit about theory, and then Arma's going to talk about how this has played out in practice in Scotland to give us that real on-the-ground learning. But before we dive in, I'm just going to briefly reintroduce myself and the network that I coordinate before speaking a bit about the work that we're doing specifically in Wales. So as Chris said, I'm Ollie. I'm the lead coordinator at the Health Anchors Learning Network. The Health Anchors Learning Network was set up about 5 years ago with funding from the Health Foundation, and we're a UK-wide network for people who are responsible for or interested in embedding anchor approaches in their roles. Now, we were also lucky about a year or so ago to receive some additional funding from the Health Foundation to set up what we're calling HAWN Wales, or sometimes we've been calling it Health Anchors Wales. And this is a dedicated new learning network supporting practitioners and leaders across Wales to make impact through anchor approaches. It's a joint programme between HAWN UK and the NHS Wales Finance Academy, and it's recognising that whilst there's lots of similarities in how organisations adopt anchor approaches across the UK, there's also a unique context in Wales around how the NHS is set up, the policy environment. So we really want to provide some bespoke resources. And our hope is that this network can support the foundational economy programme more widely by helping to develop the mindset, skill set and tools for colleagues across NHS Wales and beyond to build effective anchor organisations that create healthier, more resilient communities. So that's just a bit of the background around who I am, my organisation and the work we're doing in Wales. And at the end, there's going to be a chance for you all to input on what would be most useful in terms of what comes next from this programme of work in Wales. But now for the topic of the day. So we're going to be tackling impact measurement, which, depending on who you are, can cause some consternation. Some people are more confident. It definitely generates a mix of responses, but we always know it's something that people find really useful to dig into. So that's our plan for today. So I'll just start by outlining the headlines around why impact measurement matters. So what we've covered already in these webinars is that basic fact that NHS organisations across Wales are more than just providers of healthcare. They're major employers, major purchasers, and they're long-term partners in their local communities. That means they're already shaping local economies and influencing well-being, whether intentionally or not. Now, measuring that impact helps organizations do three key things. So first, it helps you all to understand the social and economic impact that you're already generating across communities in Wales. Second, it uses that to then identify areas where you might be able to strengthen that impact, particularly in ways that reduce inequalities and support long-term well-being. And the third and final thing is that it enables you to track progress over time and demonstrate the wider value that the NHS brings to Wales beyond delivering clinical care. And this is where I think it's useful to think about anchor impact measurement as slightly different from traditional evaluations. And that's because it doesn't focus only on new programs or pilot projects or new interventions to kind of test how effective they've been. Instead, it often is looking at your core functions. So it's looking at how you recruit and develop staff, how you spend your money, how you use your estates, and how you work with partners. So it's about understanding and then being intentional about the impact that you're already creating through the everyday decisions that you make. So I think there might be examples where there are new initiatives that you want to understand the impact of, but a lot of impact measurement in the work of being an anchor is around trying to benchmark your existing contributions to the local community, the local economy, and then looking for ways to optimize that and build a better understanding of that. Now, any kind of impact measurement fans will know that any impact measurement starts with a solid logic model or a theory of change. And what I've done here is I've just given us a very, very high level logic model for how the actions and the activities that anchor organizations enact might then lead to intended outcomes and then the wider impact that we're hoping that creates. So we've spoken in previous webinars about the work that anchors can do around widening workforce participation, so making recruitment processes more accessible or engaging young people through youth outreach, for example, to get them excited about careers in the NHS. It's also about, we've spoken about things like, fair pay once you've got employers in the door, supporting them to progress and ensuring that progression is an equal opportunity for everyone, and then supporting the health of employees as well. We've also spoken about local inclusive procurement. So I know a lot of you are already doing that, and around social value maximization. And then other things that a kind of typical anchor might look to do is, supporting greater community use of estates. And all of these activities we're hoping lead to these specific outcomes. So more local people are employed, and specifically those from target groups that might be furthest from the labour market. We're hoping that this leads to improved employee health and well-being overall. We also hope it leads to stronger local businesses and social enterprise bases in our communities. And then also we hope it leads to a stronger, more sustainable voluntary and community sector. And the overall impact we're hoping to achieve is these big lofty aims around reduced inequalities, improved population health, inclusive local economic growth, and increased community resilience. So it's useful to kind of map it out. Now you can see the way that I've used the orange here, that we move from kind of brighter orange on the left towards fainter orange on the right. And I've done that to emphasize 2 points when it comes to impact measurement. So the further right we move towards these longer term outcomes like reduced inequalities, the progressively harder it is for anchors to measure this with confidence. It's very hard to track your overall impact on reducing health inequalities locally. Also, the further right we move along that logic model, the more shared the accountability for these outcomes becomes across the whole system. So outcomes like population health, they're shaped by many organizations, many systems, and all sorts of wider social and economic factors. So it's not entirely a local health board that's responsible for that. So you kind of drift into a much more kind of shared accountability. So that's recognizing that anchor organizations are contributors, but they're not sole drivers of these outcomes. So when we think about impact measurement, it's all about finding that balance between measuring what we can reasonably influence and be accountable for, whilst also trying to stay connected to some of those longer term impact goals that we're ultimately aiming to support. So if we go too far to the left and we just measure our activity, you know, for example, you know, where we're advertising our roles and how we're doing that, we risk measuring activity without understanding whether it's actually leading to this outcome they want to achieve. But also, if we go too far to the right, we risk measuring outcomes that are, you know, or focusing on outcomes that are too hard to measure or that we can't confidently attribute to our work or our influence. So most anchor measurement ends up focusing somewhere in the middle of this logic model. And you'll be pleased to hear that others have done a lot of thinking around this. I'm sure there's a lot of thinking that's been done on this already across Wales. So you're not starting from scratch. One such tool or framework that I want to showcase, there's many out there, and I'll drop some links to these in the chat afterwards. And Arma's also going to talk about a specific one they've developed for Scotland. But one framework to support anchor measurement that I'll highlight is a toolkit that was created by UCL Partners a few years ago. And this was a toolkit that aimed to provide guidance on exactly that, on how you strike that balance between measuring activity versus trying to measure these wider impacts. And it's specifically focused on a health context to help organizations capture their activity and impact. So what they've done is they've developed a much more in-depth and detailed logic model than the one I just provided, where they really go down into all of those kind of sub areas within employment, within procurement, within estates, within partnerships, and they think, what are we actually doing here and how's it creating impact? And then within these categories, they've identified 56 indicators that health organizations might be able to measure. And they've also given some guidance around how difficult they think that might be to measure, and how suitable these indicators are for regular measurement, and then where these link to existing measurement frameworks and data sets. Now, this is a fantastic place to get started if you're just getting your head into this space. But it does have some limitations, specifically for a Welsh context. So this resource was designed with an English context in mind, so it doesn't reflect any of the existing reporting requirements or data collection contexts in Wales. And Arma's going to talk about how they then have evolved some of these existing models to support Scottish practitioners, recognizing that there's these unique dimensions in each nation. So just to bring this to life a little bit more, I've taken this screen grab from the UCL Partners toolkit to give you a sense of what are the indicators they're actually talking about. Apologies if the text is a bit small there. So one of the many kind of areas they focus on is around social value. So they have some of the indicators that you might expect. So, are we meeting our legal requirement, which was in England at the time around a 10% social value weighting in all our contracts? And that's quite a simple yes or no response. But then there's a slightly more nuanced measure that they encourage, which is, can we actually look at our average social value weighting across all contracts in the last year, weighted by value of contract? So that might give a slightly more nuanced picture of the extent to which social value is being considered as part of contracts. We then have some, I think, more other areas that you might not consider at first that are actually really impactful. So do you have clear and specific organizational guidance in place, for example, on for suppliers on social value expectations and priorities? And then they've got a few other indicators there. So what this toolkit has done is it's broken down these indicators across all of those key anchor areas to give you a starting place. And they call this a menu because it's all about choosing what works for you and tailoring it accordingly. It's not a one-size-fits-all approach. So we've spoken about that balance between what you measure and where you focus. We've started to talk about some of the indicators, and I think Arma's going to talk a bit more about that in a second. But now I just want to quickly talk about the value of the process of doing this. Measuring anchor impact is not just about filling in a table of numbers. it needs to serve a purpose. It needs to be valuable. Otherwise, it's a pointless exercise. And I think where this process is valuable for the organizations that do it, it's around how that process supports colleagues to have conversations internally. So it might bring together finance teams with strategy teams or HR teams to surface insights that maybe wouldn't have emerged otherwise. It can also identify gaps in your existing data collection where you actually realize we don't really know how much impact we're having here, and maybe this is an area we can focus more on to understand that better, which can be a springboard for taking action. It also focuses attention on opportunities. By seeing the picture clearly, it can draw attention to areas where there might be kind of under-leveraged levers to create impact. And then, very importantly, it also establishes a baseline for future progress. So if you know where you are now, you can baseline your current impact, and then you can measure in a few years' time to see where you've made improvements. And then you can use that to demonstrate the value of any initiatives that you've invested in to support that. For example, if you've made anchor work part of someone's kind of core remit within the organization, you might be able to use this improvement to make a case for further investment in that team and the work that team does. We've also, this has actually come from the world of universities. So universities, there's a whole movement around universities trying to be civic universities. They use that term more than the word anchor organization. And they've come together to develop a tool which allows universities to compare like for like against certain indicators with other comparable universities. So it's, gives them a sense of, we're here, another similar university is actually spending a lot more money locally. Maybe that's an area where there is some quick wins to be had in terms of improving our impact. So hopefully this brings to life a bit around why this process can be valuable for organizations. But I also want to recognize some of the risks and some of the challenges. So specifically, thinking about Wales, I think there's a risk when people start thinking about anchor impact measurement that they start thinking about it as another thing they need to do alongside all these other reporting requirements. So we know there's fantastic work in Wales around the foundation economy, the Wellbeing of Future Generations Act, and really kind of leading policy initiatives to support this work. But there's a risk that they are fragmented and that they just become an added burden for these organizations. And that's really what I'm hoping that we can avoid. And I think it's really important that we think about anchor impact measurement as a kind of umbrella term to describe a way in which organizations can bring this all together into one central source of the truth that avoids duplication and integrates it in an efficient way. So I'm not suggesting we do another thing alongside all the other things I'm sure that you have to report on around procurement and social value and things like that, and environmental reporting. It's thinking about how can we bring this together into a kind of single organization view of impact, so that we can be more strategic and avoid duplication. I'm going to end with some key principles for good anchor measurement. Now, these I have pinched with pride from the UCL Partners Toolkit because I think they're really good, and I will talk through each of them in turn before handing over to Arma to talk about some of this work in practice. So the first principle that they pull out is around the importance of embedding equity. So it's important not to lose sight of what anchor work is all about. So anchor work, key principle of anchor work is around improving health equity, so reducing inequalities locally. And as a result, anchors need to be intentional about how they embed this in impact measurement. So one typical way that organizations do this is by disaggregating measures by target population groups. For example, when you're looking at recruitment or the leadership makeup of the businesses that you're procuring services from, to say, are we actually being successful in creating positive impact for those communities that are facing disadvantage and are adversely impacted by health inequalities? The second key principle they pull out is around ensuring that you connect with the community as much as possible. Ultimately, if you're looking to generate positive outcomes for your local communities, they really need to have a seat at the table to say what good looks like. For example, on the previous slide where I talked about social value indicators, for example, when I spoke about that, the importance of having clear and specific organizational guidance in place for suppliers, ultimately it's not your call whether that guidance is useful. It's the call of the community partners and businesses that you're looking to reach. So working with them to understand, are you creating the impact you want? Is your guidance useful? Are your priorities the same priorities that the community have? Is really, really important. The third key principle is linked to that last slide I was talking about around the importance of building on existing work and avoiding and reducing duplication as much as possible. So, looking to integrate your anchor impact measurement with existing approaches or existing data collection processes as much as possible. Fourth key principle is this kind of no one size fits all approach. So each anchor organization will have different priorities, different populations, and different starting points. So you need to flex around this as much as possible while still being ambitious about where you might be able to get to. The fifth key principle is around using a balance and a range of measures. So that might, example, help you, assess progress in the short term, for example, by focusing on measuring a particular activity, but also measuring an outcome metric that might help you then track progress over a longer time period. So it's about finding a kind of a mix of indicators that's going to work for you across the short term, but also the long term. The sixth key principle is around creating systems for future measurements. What they mean by this is many of the indicators and the measures become significantly easier to gather if data systems are adapted to kind of capture these as standard, as a standard part of routine processes, rather than always requiring retrospective data analysis. So embedding this data collection as a kind of routine part of processes as early as possible really helps make measurement easier in the long run. So whether that's asking a few more questions when you're working with recruitment processes to ensure that you have that data as part of the process. Two more principles that I'm going to hand over. So the seventh principle is around measuring together with partners, and working in partnership on this is really key. So I know the procurement team at NHS Wales Shared Services Partnership, they're already doing great work around supporting health boards to track their local spend. So leveraging the support of these wider partners is key. Another good example of partnership work around this is in the development of anchor networks. So for example, in Leeds, they've set up an anchor network where the sole requirement for local anchor organizations who are interested in joining that network is that they undergo this detailed baseline impact assessment using a shared measurement framework that they've all signed up for. So the network says to organizations, you don't need to be a great anchor to join. You just need to be committed to measuring where you are now and then bringing that intention to make progress. So it helps kind of build accountability among local anchors. And then the eighth and the final principle is around, it's linking back to that local flexibility point. So it's about recognizing the different contexts that all of you will be working in across your organizations. For example, often anchor organizations are trying to increase the proportion of employees who are using public transport to get to work or who are walking or cycling. But this is going to look very different for a health board in an urban centre versus a health board in a more rural area. So we need to recognize those different contexts so that we are, treating those different contexts fairly and keeping that in mind. And the last thing I'll say is a lot of the indicators that I've talked about so far are quantitative measures, which are really useful for tracking progress and for giving some kind of hard data around where you're at as an organization. But it is worth saying that it is important to also bring in the stories and that qualitative data where possible, because often it's those stories that are going to give you more insight into why a particular initiative has been more successful than others. So, why did a certain approach to measuring social value actually deliver greater impact for your local community than others? And then that's really important to help you improve your anchor initiatives over time. So that is a 101 on anchor impact measurement. Thanks for bearing with me. I'm going to stop there and hand over to Arma, who's going to tell us a bit of a story about how they've taken this work into Scotland and made it really practical and useful for health boards across Scotland. So I will stop sharing.
Sorry, I'm just going to share my screen now. Can everyone see that?
We can see it, Arma. It looks like it's on presenter mode though for us.
Yeah. So let me just do this again. Sorry, bear with me. No?
That looks good to me now, yeah.
Looks good to you, great, thank you.
Thank you.
I'll just start. Hi everyone, delighted to be here today, and thank you to Ollie from Helm for inviting me to speak at this session. My name is Arma, I work in Public Health Scotland, and today I'm proud to be introducing you to our structured framework designed to support the progression towards becoming an effective anchor. It's this, an Anchors Institution Progression Framework, and it allows organisations in Scotland to harness their power as an anchor organisation. By the end of this session, you'll have a clear understanding of how this framework works, which I hope influences some of your future conversations around measuring progress on anchors. So how will we get there? What I'll be covering is why anchors matter just now, especially in Scotland, what the framework is for, how the framework works, what's happening in practice, what we're learning, and what's next for the framework. Just to give you a flavour of the Scottish context, the landscape, there are 14 regional health boards responsible for the protection and improvement of population health. Then we have an additional 7 special health boards, and Public Health Scotland is one of them. And like Public Health Wales, we also have a remit to improve life expectancy and reduce health inequalities. There are also 32 local organisations, local authorities. And we as a health board advocate that all health NHS Scotland boards can be effective anchors, but we also appreciate and know that NHS can't work alone. Local authorities, universities and community groups within a system-wide approach all have a part to play when it comes to prevention and early intervention, and also can be great anchors. So why does being an effective anchor matter now for Scotland? So similar to Wales, Scotland also have a huge health inequalities challenge. The life expectancy gap is between 10 to 12 years between the most deprived and least deprived. And there are some socio-economic challenges for this. Some evidence that we have include child poverty. So you'll see there that nearly 1 in 4 children live in relative poverty. And also we have a challenge around economic inactivity. So we have a higher rate than the rest of the UK. So these are just some of the challenges. To help reduce these inequalities, a number of frameworks were published recently with a focus to challenge Scotland's health inequalities, including the Population Health Framework and the Public Service Reform Plan, and they were published last year. There are clear linkages across the anchor dimensions that I'll be talking about in the framework from these policies, and these are just the 2 policies and drivers to address inequalities. They also have the ethos that we want to ensure greater local wealth retention by growing an economy that is inclusive for all. We've also got the Community Wealth Building Bill, which was approved this month, making Scotland the first country in the world to pass the legislation And that imposes duties on the public bodies and for them to develop their own community wealth building action plan. We've got the Tackling Child Poverty Delivery Plan, which will be, the third one will be due next year. So there are many cross-policy links, but these are the key focus on socioeconomic determinants of health. So this just strengthens the case to why this framework was developed. There does come a point where people know about the importance of a topic and they don't want to talk about it anymore. They want to do something about it and need something practical. And that's where we were at in Scotland here. We do host currently an Anchors Peer Learning Network, and that was formed in 2021. And for most of those network members, Anchors remained a challenge to understand and measure impact. So when we signposted the original Harnessing the Power of Anchor Institutions that was developed by Leeds Council that Ollie spoke about earlier, that framework was very welcomed to the network, and it was quickly decided that we tailor that framework to a Scottish context with Scottish policies and drivers in there to make it more accessible for the Scottish health boards. And that first version was published in 2024. And the adaptation of the framework was part of the background planning, as during this time, PHS and Scottish Government were engaged in planning to deliver an Anchors workstream. So all boards were asked by Scottish Government through their annual delivery planning to develop an Anchor strategic plan. And that would set out how they would work towards 3 of the 5 Anchor dimensions. In March 2024, all boards were then asked to submit a baseline of their Anchor activity in relation to those dimensions. Those 3 dimensions were seen as best practice for achieving impact. So we knew straight away there was scope and opportunity to develop and help the boards influence their Anchor activity using this framework, as it provides a clear assessment framework for Anchor institutions in relation to contributing to community wealth building. It helps identify strength in areas of improvement. It supports action planning to strengthen the contribution to the local economy, contributes to reducing poverty and inequality through an effective Anchor activities, and promotes improved environmental outcomes as part of being a mature Anchor organisation. So let's walk through the progression framework. First of all, just to say that we say that the target audience for this framework are on 2 levels. We have the senior leaders who make the intention of progression as an anchor, and acknowledging this benefits the organisation's vision, mission and priorities. However, there is that other layer that individual teams in the system responsible for progressing the actions across the 5 dimensions will be involved in scoring the framework as they have more expertise in the areas. So this could be used as a scoring tool for monitoring or a discussion tool to help influence plans, and we think that this framework does well for both. The heart of the framework, however, is the 5-dimension scoring tools. And these are the 5 anchor dimensions in the progression framework, and we stuck to the original 5 dimensions that are mentioned in the Leeds framework. And with those dimensions are subsections to focus your scoring on. So for example, within employers, we have various subsections, and they also have a scoring system. So I'll show you this. So I've extracted the workforce data feature, and you'll see there that there are scores from 1 to 4, 1 being the basic practice and 4 being best practice. The suggested actions included are examples which serve as a guide to inspire discussions. So each feature starts with a baseline of information, so understanding your workforce demographics, and then it progresses through. So the key point to note here, though, is that the activity done isn't done in a dark room with one person. It's got to be done with a group of people. That's how it works best. Especially in large organisations, we do encourage the senior leaders and delivery managers getting involved in the scoring. So within this workforce data, specifically, you would include folk like from your HR, your employability, your workforce planning. But as you progress, you might find that you bring other workstream topic specialists, such as procurement, for example, to help align social value with employability. So you can see the score feature here, but you can use the score feature, but you don't have to. The key thing is to use the content of each column to identify where your baseline is and develop your plans. Using scoring is, however, straightforward, and we now have developed some templates to help capture those overall baselines and progress. So what's the progress been so far? It's been good. Since the first version was shared, we know that a majority of the regional boards use the framework to inform their 2023-24 anchor strategies. And then when we committed in 24 that we would refresh the framework, considering a change of landscape and the widening usage of the framework across sectors, we did a lot of engagement work to inform the refresh and engage with various different partners across the system. The progression framework is now embedded in a wider community wealth building framework targeted local authorities and community partners. And we've also developed a toolkit to support the framework application. There's 4 boards committed so far from the Short Life Working Group who have committed to use the refresh of the framework. So let's hear about some live examples. So for this rural health board, they simply gave the responsibility for each dimension to colleagues across the system. You'll see the types of colleagues that the scoring was done by. We supported the procurement team with their section. And then later we supported that health board to do a wider community planning partnership session as well. And this just re-enhanced the health board's scoring and had a really lovely complement scoring to their health board and between the community partnerships. So examples of impact for that board, all CPP partners signed up to the Living Wage accreditation. They developed their own local anchor procurement network across CPP partners. They also developed a local asset transfer network, and each CP partner had reported their findings to their local senior structures. And this national board was very similar in using the framework. They circulated the framework to their specific teams, which were then returned back to the anchor programme within their board. And they felt the examples and scores were quite beneficial to help benchmark their scores and provide ideas not considered before. But without a scoring tool, they found it difficult to collate scoring, but most importantly, how to capture the commitment on how they'll improve their scores for the next review. But the examples of impact were quite quite good. They identified gaps which contributed to developing their strategic objectives and which were then submitted to Scottish Government. And these include launching an employability plan, and you'll see the details there, really quite good there. Working with local community to increase community access to green space on their base site, and increase local businesses' engagement for future tenders, and identify specific areas of spend to encourage local small, medium enterprises to bid. So we do have some key findings here. We heard that the time to complete the framework can be quite vigorous, and it can take time and puts a bit of pressure on staff. What we then did was we heard that and we thought, how do we break this down for folk? So we developed some templates for documentation and scoring, and for recording their planned actions for progress. We also heard that there might be some challenges around scoring as a self-assessment. It can be quite abstract and people might not feel confident to score. But then we do say that we encourage to score collectively with colleagues to help have a shared understanding and consistency approach. We also know that not being mandatory to complete is a challenge as well. So what we've done is we've had stronger links with Scottish Government and the Improvement Service, who are a national improvement organisation for the local government here in Scotland. So we planted the seed already for them to have an endorsement of this framework so that it lifts more weight. So there's benefits of using this framework, and we know that it helps showcase examples of good practice. People often forget how well they're doing specific pieces of work, and when they record it, it just becomes alive and it becomes a good practice to share, which wasn't considered before. It's helpful in identifying gaps and action planning. It also helps with accountability across the development stages, and once it's recorded, as you know, it just makes it real. It provides structured growth and measurable development in the anchor activity. And it also shows you what success looks like at every stage, because we do know that we can be stuck, and we feel we could be stuck in the one position for a very long time. But when you see progress, even small changes, it makes a difference. So what's next for the framework? We have the current version that we have just now looks very NHS-y. It's got a NHS look and feel. You'll know that dark writing, blue images. It's very NHS, and we felt that we had to rebrand this new version to engage with the wider sectors. Feedback from stakeholders was that the framework alone wasn't enough to encourage colleagues to use the framework. So we have developed some really good additional tools to help with people using the framework. And as I said, we had a short life working group to help with the refresh of the framework, and they've been included in reshaping all these additional tools, which has been great. So I hope that's given you some food for thought around measuring progress and impacts on anchors in Wales. I just wanted to finish off with the link to our web pages. They will be refreshed before our launch of the refreshed framework. But we also do welcome any further conversations about this area of work. And if you'd like to be the first to know and see the refreshed framework, do get in touch with us in the email. Thank you.
That's great. Thank you very much, Alma. Really appreciate that. And thanks, Ollie, as well, for helping to frame the discussion as well beforehand. I'll open up to questions now. I will return to one that Chris has posted whilst Ollie was presenting earlier, actually. And I think Alma and Ollie, you both kind of alluded to some of the points that Chris has made here in terms of some of the challenges involved where we've got quite a complex policy and legislative landscape in this space. Ollie, you talked about, trying to bring that all together and make it integrated rather than them sitting as kind of separate parts. And I think that Chris's comment here is alluding to that fact, so that you've got these kind of different frameworks and many different stakeholders involved. So Chris is asking, is there any advice on how best to identify relevant proxies for certain activities being undertaken that can be justified if challenged and relate back to an organisational perspective?
I'm happy to have a stab at that. I won't have the exhaustive answer. It's a good question. I think I'd say two things. So the first thing is around, in terms of identifying relevant proxies, you really got to do the work up front around being really clear and comprehensive with exactly what your logic model is and what your theory of change is. And just to give you an example, so as well as creating that toolkit, UCL partners also shared their full logic model that they had developed behind the scenes. And I won't talk you through it now, but it just gives you a sense of just their work was on this. So they have across the left there's all the different anchor pillars, and then they've identified very clearly, what the inputs are, what the activities are, what the outputs of those activities are going to be, what the anticipated short-term outcomes might be, the medium-term outcomes, the long-term outcomes, and then the impact. And so by doing that and creating this really clear mapping of which activities are leading to which outcomes, leading to which impacts, it enables you to identify some of those proxies, but also to identify where the this kind of link of causality might be a bit weak, and where you might have some assumptions that need testing, and then you can really focus your evidence gathering around those kind of weak links to help build the case. So I think my first advice would be really be comprehensive, map out your theory of change, your logic model in as much detail as possible. And then, I mean, the trickiest thing is that leap from, the outputs to longer term outcomes. And that's where I think you have to rely on just, the wider academic body of evidence that might be out there. So I'm just posting an article in the chat now, and that's the best example I've seen of it. Was in the Lancet, and it was looking at the community wealth building that has been done in Preston, and how that's actually led to improved health outcomes in the local population in a kind of medically sound, scientifically sound way. So then you've got to hope that these scientific studies exist to kind of give you that final evidence base that this is overall creating, positive outcomes. Alma, would you add anything to that?
No, just to say that a theory of change and logic model was one of the top tools that we had to really think about developing, because it helped with the conversations around buy-in for senior leaders. And we have done that, and happy to share if anybody wants to get in touch specifically to that progression framework. But apart from that, yeah, great.
That's great. Thanks, Ollie, and thanks, Alma. Hopefully that's helped Chris as well. So another question that's come in via the chat. So Dan Gregory, this is more a procurement related question. So Alma, in terms of the question here really is around the measurement of local spend and the kind of definition of local spend. So how are you measuring that within Scotland? And how did you implement living wage accreditation in procurement activities as well? Oh, we've temporarily lost you on mute.
Oh, sorry, I've got two screens up and yeah, I was going to suggest going maybe to the next question, but I'm here now. Really sorry about that. So unfortunately, I don't have expertise in the procurement side of things. I work on the workforce and employability side a bit more. But I do have great colleagues who can have further conversations. And I know that we had a pre-meeting just yesterday with colleagues from Wales and Ollie as well. So after this presentation, if there's any specific conversations that we can have between ourselves and yourselves, it'd be great, especially around procurement and workforce. I'm really sorry about that, but I'm very happy to take that question back and I can get an answer to you.
That's great, Arma. Thanks. And again, I think what it demonstrates is the complexity in terms of when you go into the depths of some of these specific areas. You need to be kind of an expert on everything, but I think that the connections and the network is the main point. So, and I'm sure Dan would really welcome that as well. So if you are able, I'm happy to be a conduit. If you can share the contact via me, I can link up with Dan as well in terms of the procurement specific aspects. I think just going back to so one of the points you touched upon, Arma, in terms of your presentation, was that the framework that you've put together isn't actually mandatory. So I was wondering, again, given that, how did you get buy-in from your stakeholders when the framework isn't mandatory to adopt?
Thank you. This is a challenge, and it has been a challenge. We are envisaging it'll be less of a challenge now, since we have, as I said, the endorsement from Scottish Government and our local authority partners to use this framework as part of their as part of the overall Scottish Government and local authority reporting. But before that, we realised we had to do a lot of facilitated sessions with colleagues across the board, in particular exec board leads, senior colleagues at that level. We facilitated a lot of sessions before actually going to the scoring of the framework. So we had to do a lot of sort of buy-in sessions before actually going into the framework. So it is a challenge, and having endorsement from your government really helps.
That's great, and I think actually, it's a great example of, again, that two-way conversation and helping to influence policy as well in terms of the work that you're developing, and then getting that support and buy-in from the government in terms of how that is then taken forward as well. That's great. I think just in terms of, I will ask just if there's any further or one final question. But if not, then I might ask Ollie if just in terms of a couple of minutes, you have any thing to share in terms of the next steps and what we'd look to do to develop the network further beyond this meeting.
Thanks, Chris. Yeah, so as Chris said, this was the third and final webinar of this series. However, there is still some resource left for this specific project, and so we're really keen that we continue delivering really valuable resources to support this work in Wales. So there's 2 points I want to make now, and then I'll hand back to Chris. One is just a reminder that we have set up a dedicated learning site for collating resources that are kind of unique to Wales around this. I will drop a link to that learning site in the chat now. Currently, it requires a membership, an NHS email address to access. but we're in touch with the team, and we're going to remove that. We're going to make it free for everyone, just to reduce the barriers even more. So there's a link there, and that's got links to case studies, wider learning resources. There's also links in there to some of the work that Public Health Scotland have done. And we're always looking for more case studies that we can feature as part of that learning site. And then the second ask is, I think Lauren's going to drop an evaluation form in the chat. So if you've attended this webinar or any other webinars as well as this one, we would love your feedback. What's been valuable, what hasn't been valuable. And then there's also some optional questions in there around what challenges are you experiencing on the ground, and then what additional resources can be most useful. So this is all going to help us deliver more useful resources over the coming months, but also possibly making, you know, a case for continued investment in this work. So we managed to access some funding from the Health Foundation. You know, the more we hear from you on what's been useful and what hasn't, the more we can make the case for continued investment in supporting this work in Wales. So thank you, Lauren, for dropping that in the chat, and that's all from me. So back to you, Chris.
Oh, that's great. Thanks, Ollie. Really appreciate it. And appreciate your support in helping us to develop and bring these sessions together, because I think, again, the learning that's come out of all three of these sessions has been really valuable, and actually demonstrates, again, for me, the impact of having the network across the whole of the UK, because again, we've learned from Northumberland, we've learned from ourselves in Wales, we've learned from Scotland. So again, having those UK wide connections as well to understand what's happening in other areas is really powerful. So I would like to say thank you very much for your time today. Thanks to Ollie for presenting. Thanks to Arma as well for joining us to present. Diolch yn fawr, everyone. So thank you very much for joining. Hope you found the session useful. Please do contribute to the feedback form. We really would love to have your feedback and responses, and ideas, again, for how we develop this and take this further forward. But I'll leave it there for now. Wish you a very good rest of the day. Thank you again, and take care.